Hi everyone, I'm Alyssa and I'm going to be talking about spirituality and mental health um, and how to incorporate it into our social work practice. So I wanted to start off by defining spirituality. I have a quote here by Brene Brown, and it says that spirituality is recognizing and celebrating that we are all inextricably connected to each other by a power greater than all of us, and that our connection to that power and to one another is grounded in love and compassion. Practicing spirituality brings a sense of perspective, meaning, and purpose to our lives. So to elaborate further on that quote, spirituality can be referred to as a complex concept that has shared aspects of the human experience, as well as individual aspects that affect everyone differently. Spirituality involves a universal human quality that includes the search for a sense of meaning, purpose, morality, well-being, and profoundity in all relationships. Attributes of spirituality include being inherently sacred and being connected to love, justice, compassion, forgiveness, and humility. And it's important to note that spirituality can be expressed in religious and non-religious forms. Sometimes they coincide, sometimes they don't. Getting on to the topic, so spirituality and mental health. Spiritual practices have been proposed to have many beneficial effects as far as mental health is concerned. Spirituality can allow people to find purpose and meaning and to cope with feelings of stress, depression, and anxiety. Spirituality also allows individuals to restore hope and optimism in their outlook on life, and additionally to find a sense of community and support with other spiritual beings. So the impacts of spirituality can be shown by research, and a few of the positive findings related to spirituality and better mental health outcomes are covered in these studies. So research has shown that religion and spirituality can help people cope with everyday stress. One study found that committing to consistent spiritual experiences helped adults be better able to cope with negative feelings and enhance their positive feelings overall. Another study demonstrated that older women who were more grateful to God received greater stress buffering health effects due to the gratitude experienced in their daily lives. And then another study done to examine spirituality and religious orientation as a means of coping with exam anxiety has been shown that those who are more religious exhibit less physiological activity or reactivity towards stress than those without religious orientation. So continuing on to that, this was in one of the videos we watched in class, but in Lisa Miller's book, The Spiritual Child, The New Science on Parenting for Health and Lifelong Thriving, she discusses some statistics in people who identify with a strong sense of spiritual connection. So she states that these individuals are 80% less likely to develop substance dependence or abuse problems, 60% less likely to develop major depressive disorder, 70% less likely to engage in sexual risk-taking, and 50 to 80% less likely to die by suicide. There's more studies too about spirituality and the correlation between better mental health outcomes. Some of them reveal consistent relationships between level of spirituality and depressive disorders. So of 93 observational studies, 2/3 found lower rates of depressive disorder with fewer depressive symptoms in individuals who were more religious or spiritual. And these studies also found that greater spirituality led to milder symptoms of depression and a faster remission of the symptoms if they did occur. Most religion actively discourages the use of substances, and studies indicate strong negative associations between substance abuse and religious involvement. So a review of 134 studies that explain this found that individuals were 90% less likely to develop substance abuse disorders the more religious they were. So conclusion of all of this research, basically, studies show that spirituality and psychological well-being are directly correlated. Existential thinking and meaning-making are related to better mental health outcomes, and research demonstrates that there are lasting benefits to maintaining involvement with a spiritual community, and gratitude that accompanies spirituality can be a great buffer against stress and physical health problems. If spirituality is stable over time, it contributes to greater subjective well-being in individuals. I wanted to get into some of the neuroscience of spirituality and how this research that has shown that it benefits people's mental well-being, what it's actually doing in the brain to benefit people. So there's not that much information regarding the neural correlates of spiritual practice, and the studies that are around have focused mostly on meditation practices and its effects on the brain. So the studies and the information presented are going to focus on what happens in the brain during meditation. So to start, the hippocampus and amygdala are stimulated directly during meditation. The hippocampus plays a major role in learning and memory. It's a vulnerable structure that can be damaged by a variety of stimuli, including stress. The amygdala is a neural system for processing threatening stimuli that can also be activated in the presence of non-threatening stimuli if someone is predisposed to it or has experienced toxic stress or a lot of trauma in their life previously. Imaging studies like MRIs have shown increased activity of the hippocampus and the amygdala during meditation practices. So when the right side of the amygdala is stimulated in congruence with the hippocampus, what happens is we see a stimulation of the parasympathetic nervous system. So this allows for a decreased heart rate and relaxation as a physiological response. The parasympathetic nervous system is integral for allowing individuals to rest and regulate their emotions. With consistent meditation and access to the relaxation benefits of the parasympathetic nervous system, individuals see a decrease in noradrenaline, which is a neurotransmitter that initiates the fight or flight response. So it's an anxiety-inducing neurotransmitter in case of danger. So the decrease in this neurotransmitter leads to a lessened stress response in an individual's life and a greater ability to deal with actual stressful events when they occur without it being constantly stimulated by non-stressful events. So we're going to build on this in terms of neurochemistry. So there's an increase in dopamine and serotonin levels during meditation. Meditation has been shown to increase dopamine release by 65%. Dopamine plays a role in our movement, memory, focus, and it drives us to seek and repeat pleasurable activities. So it's a reward center. Dopamine is often released in activities including eating, exercise, or sex, and low levels of dopamine can be responsible for depressive disorders and a lack of motivation to fix it. So it's hypothesized that the dopamine increase is due to the reduction in the cortisol levels and reactions, as well as the physiological responses. Serotonin levels are also increased during meditation. Serotonin impacts every part of the body, including our emotions, our motor skills, and it's most notably known to reduce depression, regulate anxiety, heal wounds, and maintain bone health. So to link the theory to practice. So dialectical behavioral therapy is a modified form of cognitive behavioral therapy, and its main goals are to teach people how to live in the moment, develop healthy coping mechanisms, and regulate their emotions. DBT intersects with Zen Buddhism and neuroscience, and it has been used effectively already to work with clients experiencing emotional vulnerability, self-injury behaviors, and an inability to regulate their emotions. So DBT uses Buddhist practices or philosophy, and that includes deep breathing, mindfulness, and in these practices, we direct our attention away from upsetting stimuli and regulate the physiological response in an individual. So the skill of mindfulness is taught in DBT by focusing one's attention on one thing at a time rather than letting their mind wander. And again, this exercise is used to reduce emotional and physiological arousal. So when DBT is practiced consistently, individuals start to reap similar benefits of the neurological benefits as meditation. So these benefits include, again, increased serotonin levels, increased impulse control, better emotional regulation, and a reduction of the autonomic nervous system. Finally, we have implications for social work practice. So the reason we should incorporate this in is the work in neurochemistry or science allows us to, first of all, have the information that can help us explain why interventions such as meditation work for clients, and furthermore, to explain this to our clients. So by providing psychoeducation, it allows us to offer information on the nature and the course of a client's problem. So psychoeducation aims at facilitating interventions, optimizing patient cooperation, and preventing relapse. Emotional regulation skills are taught and trained across many therapeutic approaches, but often the psychoeducation of this approach is not explained to the client. So when we have the ability to explain the psychoeducation of our treatment, what happens is the client can understand that like this problem is normal, it's a normal stress response to what they're dealing with, and how the treatment will benefit them in the long run if they're able to commit to it or do it. So when we're working with clients dealing with anxiety, depression, or other mood disorders, understanding the role of the autonomic nervous system in the client's concerns is imperative. So we can explain how chronic stress or trauma can affect their ANS involuntarily, long term, and that their emotional responses are indeed normal. We can then explain how an intervention such as meditation can increase the myelin tissue in their brain, which will help them be able to form new neural pathways faster, and also positively stimulate the hippocampus and the amygdala, which again is it controls like pleasure centers and decision making, impulse control. And then we can then explain the long-term benefits of meditation and its role in stress reduction and emotional regulation, as noted in our previous slides. So by using psychoeducation and understanding our treatment's neurological effects, we can provide concrete examples, education, and hope to clients looking for relief from problems.